Now, if the stone is in the kidney, that is the uppermost portion of the genitourinary tract. Now, we have got three modalities of treatment of kidney stones when the stone is in the kidney. Now, the first being the ESWL, which is extracorporeal shockwave lithotripsy. The second modality being the RIRS, which is the retrograde intrarenal surgery, and the third being the PCNL, that is the Percutaneous Nephrolithotomy. Now, when do you offer these modalities of treatment to the patient, and how do these modalities work? Now, ESWL, as I said, that is extracorporeal shockwave lithotripsy, can be used in patients when the stone is in the kidney and is of a size less than a centimeter, that is less than 1 centimeter. Now, what is this ESWL? It is a daycare procedure wherein the patient goes to the center where this facility is available, and there are shock waves which are being transmitted to the kidneys from external source. So the patient is not anesthetized, the patient is not admitted. So there are external shock waves which are transmitted to the kidneys under sort of local anesthesia, and these shock waves will fragment the stones. Now, once these shock waves will fragment the stones will propel out spontaneously through the normal passage from the ureter into the bladder. Now, this limitation of the extracorporeal shockwave lithotripsy is that it cannot be used when the stone size is more, because the stone fragments will be larger for them to pass through the normal urinary pipe. Secondly, it also depends on the density of the stone. Now, the density of the stone is, in a layman's word, is the strength of the stone. Like you wattage, like a bulb has a wattage of 60, 80, 100. So the stone also has its power, and this power is being ascertained by CT, that is the computed tomography, which ascertains the Hounsfield units. The Hounsfield units is the strength of the stone which is being calibrated. Now, ESWL is not successful in stones which are more than 1000 HU, that is 1000 Hounsfield units. So you cannot offer this modality of a treatment in patients who have got kidney stones less than a centimeter with Hounsfield units of more than 1000. Also, another disadvantage of the extracorporeal shockwave lithotripsy is that during the shock waves, there occurs some damage to the kidneys. Because of these shock waves, patient can have bleeding, and there can be some nephron damage which is happening. So this is another demerit of ESWL. The only advantage being the patient feels that he is not undergoing a major procedure. It is an daycare procedure. It is an OPD procedure where the facility is available. So this was the first modality which I have explained, that is the ESWL. Now, the second modality of treatment for the kidney stone is PCNL, that is the Percutaneous Nephrolithotomy. Now, what is this? Now, this is an invasive procedure. Now, what is the indication for this PCNL? Now, the indication being the stone has to be more than 2 centimeters. Now, this procedure is reserved for these stones which are more than 2 centimeters. Now, what exactly is done in this procedure is the stone is being approached from the surface of the body. That is, the kidney is punctured from outside. The tract is created from the surface of the body to the kidneys. The tract is dilated. Through this tract, using intracorporeal lithotripters, which can be either pneumatic or ultrasonic, or combination of pneumatic and ultrasonic, or at times laser, we can fragment the stones. Now, the major demerit of this procedure is that there is a higher tendency of bleeding, because you puncture the kidneys, and kidney is a very vascular organ. So there are chances that the patient may have bleeding. So bleeding tendencies in this procedure, that is the PCNL, is comparatively higher, and risk to the patient is slightly higher than the other modalities of treatment. So this is the PCNL. Now, the third modality of treatment for the stones in the kidney is the RIRS. So this is of late the most recent advancement in management of kidney stones. And what is the indication for this RIRS? So this is usually reserved for patients who have stones less than 2 centimeters. People who have undergone ESWL in the past, but they have failed after multiple sessions, multiple shock waves. These people can be subjected to RIRS. Now, what is RIRS? It is the retrograde intrarenal surgery. So this is the latest upcoming and advancement, wherein the kidney is approached through the normal urinary passage. So there are instruments which are available which can be introduced directly into the kidney. So the patient has got no external cuts, and then no stitches, no external surface wounds, any chances of bleeding are little less. So the kidney is directly approached through the normal urinary passage using a flexible ureteroscope, flexible ureteroscope. Directly we go inside the kidneys and then we lase the stones. Now, there are instances wherein the textbook literature says that the stones up to 2 centimeters only are the indications for RIRS. Now, there are people, and even myself, I have performed the stones up to 3 to 3.5 centimeters with RIRS. And now the only exception in this case is that you may have to take at least 2 stages to clear the stone. The very much advantage of this procedure is that patient is back home the next day, and the hospitalization is only a day. Chances of bleeding, as I explained in PCNL, is minimal. The pain post-operative is very less. So RIRS is one of the latest innovations in the management of kidney stones. So to summarize the management of kidney stones, first modality is ESWL. I have explained the advantages as well as disadvantages of ESWL. The second modality, which I've explained, is the PCNL. The third modality is the RIRS. So all the 3 modalities I've explained when it is to be done, when it is to be planned.